Tomorrow is World No Tobacco Day. Joining us live is Erin Siniscali. She's the director of St. Peter's Health Partners Community Health Programs. Good afternoon, Erin.
Hi.
So let's start out by talking about what is the mission of this awareness campaign.
So World No Tobacco Day has been around for over 20 years. And the idea on World No Tobacco Day is that they want people to try to quit smoking, abstain from tobacco products for 24 hours. So this year's theme is lung health and tobacco use.
And what are some of the ways that people can, say they're having a really hard time quitting smoking? What are some of the ways that people can even, try for 24 hours?
Sure. Quitting smoking is incredibly hard, and that's why St. Peter's Health Partners offers program. We offer community programs that people can join. There's 7-week programs where you get support to help you quit. And we do encourage that you talk to your healthcare provider about ways to quit smoking. If you want to try it for one day, the best advice I can give you is to have a plan. Because when folks wake up tomorrow morning and decide at that moment they want to quit smoking, that's when it's the hardest to do it, because you don't have a plan in place for how you will deal with all those triggers throughout the day. And that's the reason that people relapse, because they're faced with a trigger. They've spent probably their entire adult life smoking, and maybe even all of their teenage years smoking. And so you learn to associate the things you do throughout the day with a cigarette. So when you wake up in the morning and you typically smoke, when you eat and maybe you smoke, when you're in the car and you smoke, or when you're on a lunch break and you smoke. So you're still gonna do those things every day. You're still gonna wake up, you're still gonna eat, you're still gonna have a lunch break. And what do you do instead of a cigarette? So if you can prepare yourself for that, for some strategies of how you'll break that part of the habit, if you will. The other thing that we recommend is that people use a medication to help them quit smoking. So there are actually 7 different medications that people can use that are approved for quitting smoking. So you can get a nicotine patch, nicotine gum, nicotine lozenge, and you can even get some of these in smaller sizes now, so you don't have to buy a 2-week supply at a time. You can get your physician to write you a prescription for nicotine nicotine inhaler, nicotine nasal spray, and then there's also Chantix and Zyban, which help you quit smoking. If you use one of those products, it will help take away all the physical cravings, and then you've got to deal with the things that trigger you to want to smoke, the psychological component of it throughout the day. And that's where you need to have a plan and decide what to do in advance when you're faced with a situation where you want to have a cigarette.
For somebody, again, who is a smoker and hasn't really committed to quitting yet, the mission of World No Tobacco Day, the theme this year is tobacco and lung health. For those people who are on the fence, what can you say about the impact of tobacco use on lung health?
Yeah, absolutely. So we know, and I think most smokers know too, that certainly tobacco use is affecting the lungs. It's affecting every part of your body, but the lungs are what you often feel the most. It's why when you wake up in the morning and you haven't had a cigarette for several hours, you're coughing, and your body's trying to get the tar and the chemicals out of your lungs in the morning. So you tend to feel those effects. What you'll also realize when you quit, and a lot of smokers don't realize this when they are smoking, is that their lung capacity expands when they quit smoking. And within just a few weeks, you'll actually be able to breathe easier when you're walking or running or doing stairs, and you'll be surprised with the difference because you haven't felt that before. So it does affect the lungs, certainly with lung cancer. That's the one we hear about a lot, but also COPD. One of those might be emphysema. So a lot of physicians will tell you that smokers all experience some level of emphysema, and that's damage done to the lungs where they can't quite expand the way that they used to or should. But the good news is that when you quit smoking, from the day you quit, any emphysema that has started will stop. We can't reverse it, but you can stop it right then and there.
And as far as support services that St. Peter's Health Partners offers, what are some of those?
So St. Peter's Health Partners has a program called the Butt Stops Here. So there are several different locations in the capital region where you can go to these groups for support. It's led by a trained facilitator, and it's your peers who are also trying to quit tobacco products. So you can call St. Peter's Health Partners to sign up for that. We're going to put some links below so that you can go on the website, you can get the phone number, and you can register for that. And again, if you can talk to your healthcare provider, they are trained to help you quit smoking. They can write the prescriptions, and your insurance might cover some of the over-the-counter products as well at a very low cost to you. So you can get more information about that. And then the other thing we recommend is calling the New York State Smokers Quit Line. And so we can put the number for that on this post as well. So you have that number, you call them, they can help you over the phone. You can also go to their website if you don't want to talk to anybody. Go to their website, fill out the form, and most people who do that will also get some free patches in the mail to get you started on the cessation journey.
Great. Erin Siniscalli, thank you so much for taking the time today to talk about World No Tobacco Day, which again is tomorrow, Friday, May 31st. Thank you.
Thank you.